Hey, what's going on? Dr. Trevor Miner, physical therapist here. We all know that we should be taking outcome measures when we're working with patients in the home. The issue is that outcome measures, they're not easy to take in the home due to the setting we're in, right? The lack of space, the lack of appropriate seating or chairs available, those sorts of things. But it's important that we get the most accurate outcome measures possible. So today I'm going to talk to you about my top tips, my top 8 tips for taking or assessing gait speed or gait velocity in the home. Let's go. All right, tip number 1. Now, when you're looking to set up your course, the most common thing to do is to use like painter's tape and put a starting line and an ending line, and that's certainly an excellent option. Sometimes I don't like just getting out tape and sticking it on their floors, but it's an option, and it's a good option. I tend to look for some of the surrounding features of the home. So what I mean by that is sometimes I'll use a grout line as a starting or end line, or I'll use the edge of a wall or a piece of furniture as a starting or end line as well. At times I also use a laser line on the ground because I tend to carry a laser line with me, and that's a perfect starting and ending line if you have that. Or you could use a cone. You want something that's going to be easy to see when they cross that line. Okay, but don't be afraid to use the features in the home. That's tip number 1. Tip number 2, do not guess or use your feet to measure distance. Again, do not guess or use your feet to measure the distance. I wouldn't even recommend using tile because tile can vary. It's not always the exact same. And if you're guessing or using your feet or something and you're 5, 10, 15% off over the course of the distance you're measuring, what good are your numbers? They're not. You can't really use them to compare to normative data because it's not accurate. So instead of using your feet or guessing, use a tape measure. You can get a nice compact tape measure that'll fit in your bag, and you can use that. You could use a rolling measure. That's a good option as well. It's a bit bigger, but you can use it when you're checking actual gait distance, over longer distances. So that's a good option. You could use what I prefer to use most of the time, which is a laser measure. It's compact, fits in my bag, lightweight, and I can use it very quickly measure distances for gait velocity or gait speed. So I can use it to just point at my end line, which would be the edge of a piece of furniture, or maybe a wall, and then mark my beginning line, the end line, and I can put down a laser on each end or just use that wall or the piece of furniture as the end line. Super fast, very accurate, and you can use it for other things because you can get one that would measure up over 100 feet, so you can check walking distance as well. Tip number 3, if at all possible, if you have the space, certainly use the 10-meter walk test, okay? The truth is, in home health, it's very unlikely that you have this distance unless, of course, you're seeing someone in an assisted living, independent living facility, in a setting like that where you have access to a hallway. But if at all possible, do the 10-meter walk test. If you're unable to do that, but you still have about 30 feet, then you could do the 4-meter walk test, which has 2 to 2.5 meters ramp up and ramp down on each end, with 4 meters in the middle. Okay, that would be the next best option. If neither one of those is possible, do your absolute best to find at least 18 feet of continuous space in your patient's home. What that will allow for is a 5-foot ramp up and ramp down on each end, and then 8 feet in the middle, which is really the minimum recommended distance. So if at all possible, try to get 18 feet. If you have to cut the ramp up or ramp down a little bit, maybe that would be an option. But do your best to get at least 8 feet to check gait velocity. Tip number 4, try to keep your course on one surface. So in other words, you don't want your course to start on carpet and then go to tile or go to some other surface, all right? You're gonna wanna try to find an area in the home that has one surface available for the longest distance. If the only option is to transition between surfaces, certainly do that, but you might wanna make note of that in your documentation. But aim for a hard, flat surface such as tile, linoleum, hardwood, whatever it is, okay? And that's gonna give you your most accurate gait speed. Also, don't be afraid to move light furniture, so chairs or things of that nature, to make some space. Of course, asking your patient if that's okay first, but you could do that to try to get a nice path available. Tip number 5, prior to starting the assessment, you're going to want to tell your patient to avoid talking or being distracted from anything. So you're going to want to look and make sure there's no pets in the way. If there are pets, make sure they're out of the room, out of the way, so they don't impact your patient's walking. Also, a lot of times, just other people in the home, family members, might try to talk to you or try to talk to them during this, and just ask them to please hold off until you're done with the assessment. Tip number 6, you're going to want to get, if at all possible, a usual speed and fastest speed. In fact, you're going to want to try to do 2 trials on each usual speed and fastest speed, and then average those to get the gait speed under both conditions. Now, depending on the patient, that may not be possible. So the next best thing would be 1 trial on each usual and fastest. And if that's not possible, then you can go down to just usual. That would be the next best place to go. So remember, 2 of each, usual and fastest, with an average of the 2 trials if possible, but always get at least usual speed. Number 7, use a gait speed app. Okay, I have one that I personally made. It's available just on Google Play. I'll put the link down below for that. It's totally free. But there are others available on Google Play and iOS as well. But use one. It will save you time, frustration. It simplifies the process. And the more organized and quickly you can perform the assessment, the more likely you are to do it. So in the one that I created, it allows you to put in a custom distance. You can do it in feet or meters, and then you can output in feet or meters. And then you can take up to 3 consecutive trials with an average automatically calculated. So once again, that link will be down below. Tip number 8, the last tip. It's important that you document absolutely everything, okay? So you're going to want to put what assistive device was used, if any. You'll want to document what corrective instruction was provided, if any, specifically during the assessment. Sometimes people have to be redirected or reminded what they're doing. You'll also want to list, if it was on some uneven surface or there were changes in the surface, that would be a good thing to put. You're also going to want to put the distance that you assessed them over. So if it was 5-foot ramp up with 8 feet in the middle and 5 feet on the end, go ahead and document that. That way you have good information to base your next assessment on, or if someone else is coming after you, they can recreate the same path and get a result that will compare accurately to the first one. All right, that is it. Those are my tips on getting gait velocity or gait speed in the home. I hope you find this useful. Thank you for watching today, and I'll catch you guys in the next one.